Hello, this is Martin Murray, and this is the panel at Dublin BIC. Today is Thursday, the 2nd of April. We are in the middle of the COVID-19 pandemic. Much of the economy has been closed down. At the front line of the pandemic, of course, is the healthcare sector, and which in many countries, including Ireland, is working to or beyond maximum capacity. Today, I am joined by two innovators and entrepreneurs in the digital and tele-healthcare sector, and they are Sonia Neary, CEO and founder of Wellola, and Keith Lyne, founder and CTO of MyClinic365. You're both very welcome.
Thanks, Martin.
Thank you. Thanks for having me.
Sonia, if I could come to you first, can you introduce us, please, to Wellola and tell us what have you been seeing relative to your business in the last number of weeks?
Yeah, sure. So Wellola is a digital health software company. We very much believe in what we call hospital-at-home care models. So I'm a physio by trade, and my co-founder is a medic. And acute reactive hospital-based care system isn't really the ideal system for many patients. And so since about sort of 2014, we've software that supports both clinics, sort of sole trading practitioners, and hospitals to securely communicate with and care for their patients in the community setting if possible. And the tools that we offer would be things like a clinician interface and a patient-facing app, and it allows for things like telehealth via text or email or in-app, online booking and payment facilities, and a full patient portal where patients can fill in screenings or receive documentation from their clinicians and so on. So it's software as a service, and it's same-day setup. So yeah, that's a little blurb about kind of who we are.
And tell me, what have you been experiencing the last few weeks?
So the last few weeks have been really busy for us. Our model, while it's sort of a subscription as a service model, is also an enterprise level model where hospitals or professional bodies would come to us and say, can we give them a version of Wellola for their to their branding for their hospital or network. And we worked with the Digital Transformation Academy in the HSE ourselves, including a lot of other products as well, were offered to GPs and primary care and acute hospital settings to support this kind of digital communications between patients and clinicians. So one of the platforms that we released was a platform for GPs to support them to communicate with their patients. Equally, we're launching one with a mental health care group in Ireland and one in the UK in about a week's time. And they have about 50,000 mental health care professionals that will be using our system. So particularly, I think at this time, people are suffering, in addition to how they normally kind of have, mental health care concerns, with the additional stress and everything that's happening and the anxiety around this unknown world that we're living in. So tools like this can be really helpful to kind of continue engaging, the patient with the mental health care. It's been really busy for us, and in a really good way. We're kind of glad to be able to contribute in some way to what's happening for people at the front line of healthcare at the moment.
Very good, Sonia. Thank you. Keith, if I could come to you with the same question. I know your MyClinic365 is headquartered in Killarney, County Kerry. Can you introduce us to MyClinic365 and tell us how you've experienced the last few weeks?
Yeah, no problem, Martin. So MyClinic365 is a patient engagement platform. We're very much focused on reducing administrative burden within that setting. And I suppose what we're looking at is really the patient journey and improving communication with the patients. I suppose the technologies we offer GPs are very similar at the moment to Wellola, what Sonia mentioned. We use, which I suppose our differentiator there really is, we use intelligent virtual assistants to communicate across all channels. So we've really gone down the voice route. We believe, I suppose we all live in conversation, and conversation is how we communicate. We also have our own secure WhatsApp-like messaging platform built into the system. But again, as I say, it's very much built around conversation, because we believe people live by conversation. And if we can engage patients in conversation using our technology, then we believe we can provide a better experience for both patients and doctor, and improving the patient engagement will improve better and give us better health outcomes. So we're very much focused on general care, primary care. very much focused on trying to reduce that administrative burden. So the telephone calls, so our voice platform will answer the phone for the GP practice, etc. We also have a telehealth platform. And I guess we've very much been looking at how healthcare is going to change. And I suppose this pandemic has very much changed, I think, how primary care and healthcare in general looks towards digital health and digital health platforms. And we have some very exciting new technologies coming out in the coming months that we believe will change how patients consume healthcare, especially in the primary care setting. So I think, to follow on to your question, how have we been affected in the last week? I think the team has been extremely busy. We've been providing our platform free of charge to general practice and all allied healthcare professionals. The team has been extremely busy. Laura, as you know, the co-founder, is a GP, so her practice has been under significant strain. So we've kind of lost a resource within the team there. But it's been great to give something back to the community and to I suppose, the people at the front line.
So can I take a step back from the pandemic and ask you, what are the driving forces now within the healthcare sector that are driving change, perhaps towards more digital healthcare delivery? What's driving that?
Well, I suppose if you look outside of the pandemic and you look at where legislation was going, if you look at Medicare legislation in the States as an example, or the NHS digital strategy, you can see they're very much moving towards a digital health, a telehealth strategy. It's very much, I suppose, driven, if you look at, there's a number of variables, but I suppose one of the big ones is the lack of healthcare workers. And if you look at the World Health Organization forecasts, there's going to be a huge shortfall in the number of healthcare professionals available to provide the services that people expect. So something's going to have to fill that gap, and that gap will be filled by products such as ourselves, or Wellola's product, which will provide digital health facilities that will help enable those healthcare practitioners to provide services. And I also believe the consumer, the patient, will also want more access to digital health, will want more control of their own health services. And I guess health tech will have a huge part to play in this as well, and that the consumer, I think, will want to be able to provide information back into their GP, be triaged remotely, etc., and then maybe have a telehealth consultation at the end. So we need to streamline it from a patient's perspective, need to streamline it from the primary practitioner's perspective, and it needs to be seamless, and it needs to work. And I guess that's where it's going to be, because GPs won't have the time to give to patients, and the patient, as I say, will want control of its own experience.
That's a very, very interesting point, Keith. So at a global level, according to the World Health Organization, the personnel simply aren't there to continue in a traditional manner with one-to-one in-person engagements. It's not a choice between that and using the technology. The technology actually is the only option going forward.
Well, yeah, the technology will have to reduce the admin burden on the primary care consultants and on all the healthcare professionals. And I suppose, even if you look at the rhetoric on the web at the moment, and you talk to consultants, or you talk to primary care practitioners, the electronic health record, which is giving so much information back and has really transformed healthcare, it's also led to what they're saying is physician burnout, because there's a huge amount of time now spent doing the administrative elements of just even typing into your electronic health record and keeping the electronic health record up to date, and all the administrative work that flows through from that there's less time being given to the patient and more time being given in front of the computer. And if there's technologies, which there is, that can help change that pattern, so there's more time spent looking and dealing with your patient than typing, and then, I suppose, using that as an example, inputting electronic health record, well then that's a huge saving, and it's giving back something to the patient, and it's giving back time to the healthcare practitioner.
Sonia, could I ask you, when you're talking to your clients or to your prospective clients, what are the drivers for them? Is it about increased efficiency, increased efficacy? Is it about increased profit? What's driving them to take on your solution?
Yeah, completely in line with what Keith is saying there. I think it falls primarily into two categories. One is cost saving, and the other is really kind of giving humans the opportunity to do what humans do best and replace the kind of mundane digital kind of, or you know, administrative tasks, you know, and offload those into some kind of automated digital facility. So for example, and I've mentioned this before, is that the kind of cost, like the NHS spent $1 billion on patients not showing up last year, 100 million on post. That kind of cost, if it were applied to hiring or, you know, important equipment, is a phenomenal cost to be losing out, that could be kind of fixed by simple things like appointment reminders, giving patients the tools to schedule or reschedule. And yeah, absolutely. The NHS have a digital front door policy, really, is what they're implementing across all kind of health sector, be it acute or mental health or primary care. And countries like Portugal and Germany have a mandate now whereby the patient has to be given the option of either an in-person or an online consultation. So again, you're kind of optimizing the diary and making sure people can be turning up, you know, that the restrictions or the barriers to them turning up are removed where possible. So what's been interesting with this for us is that we kind of, as I said, our model was all about kind of a hospital at home model where the patient was at home. But something that's arising now for us that wasn't there is that the clinician is also at home. So for many of the doctors we're talking to, they're in quarantine, you know, they don't know if they've been exposed, so they're not actually in their clinics at all. And they need a facility where they can comfortably know that their patient data is being held securely, that they can communicate back and forth with the clinic or with the patient and work remotely themselves. So that's quite a new thing that wasn't really there before this pandemic hit, if that makes sense.
Everybody is asking in regard to the pandemic, in regard to consumer behavior, economic behavior, the world of finance. On every dimension, people are asking, what's the new normal going to be after the pandemic? How are things going to have changed irreparably? We've seen, for instance, in the Irish healthcare sector that there's been a move towards partial, temporary nationalisation of the private healthcare sector. And some commentators are saying, hey, great, why didn't we do that before? And why don't we keep it that way? What do you think are the changes that are going to remain or that maybe should remain to either of you?
Yeah, certainly I feel, and you know, any kind of event that I would have gone to in the last sort of 12 months, you know, that there's a lot of really positive attitude in the health sector locally to digitize. But everything that was, you know, being commented on was kind of saying, you know, actually, you know, we're about 10 years behind other industries in terms of how we've digitized. We're miles away from it happening. And literally in the last month, we've probably stepped forward about, you know, 5 years in terms of how we've digitized our health system. And I think that will last. And it was something that needed to happen because the way that things were going, we were getting, you know, an older demographic living longer with chronic conditions. The model that we had, the kind of acute reactive hospital-based care model, wouldn't have been sustainable. So in many ways, the kind of silver lining to all of this is that we have brought our health system forward into the modern day in a very short space of time, and that will support us to care for an aging demographic with chronic conditions in the home environment where we can, where I don't think we would have been ready if this hadn't happened. But open to your thoughts, Keith, on that.
Yeah, no, I'm in complete agreement. I guess even if we were to look at it at a higher level, even from the HSE's procurement process to where it is today, to where the legislation was, to where they were thinking, I think you mentioned 5 years, it could even be 10 years. It's moved so fast, and it's fantastic. And I think digital health is required. It's needed if we're going to, like, I'm sure I'm dealing with the GPs, Sonia, you're dealing with the healthcare professionals also, and you hear their rhetoric, and they were all ready for digitalization. They all wanted digitalization, but there seemed to be this blocker. And then when you looked, I suppose, further afield globally, you mentioned Portugal, you mentioned UK, even the States, you see where their legislation was going, where their digital health strategies were going, and it just seemed that Ireland was lagging behind. But all of a sudden, this has created an opportunity to, I suppose, to test the water with digital health. There'll be some successes, there'll be some failures, which is fair enough, but I'm sure the good ones will be kept, and that's the main thing. And I guess then possibly from a consumer, and again, you mentioned multimorbidity and the aging demographic, these guys are all going to require a huge amount of care going forward. And digital health platforms, lets them interact easily and seamlessly, and information gets to the right person at the right time is the key to looking after this type of individual. But then talking to other GPs recently, they think the way they provide their service is going to change fundamentally from this. I'm not. The question is whether individuals want to will they ever again want to come into a waiting room? Like there's question marks. Very simple things. Do you want to be waiting with 20 other people right now? Is there going to be a COVID season like there is a flu season right now? Like there's a lot of unanswered questions, and it's hard to forecast the future. But I suppose the future is digital health in some form or another. And I think if there is a pro out of this, it's that Ireland has now brought itself into the digital future in regards to healthcare.
Very good. I know there's many people who would say that we missed an opportunity to innovate and transform around the time of the 2008 financial crisis. So hopefully we don't waste this crisis similarly, and we actually execute on some of those innovations you're talking about there. Thank you for that. My last question to you both. You're not just healthcare entrepreneurs, you're also entrepreneurs. Do you have a top tip for startup and scale up businesses that are working their way through this now?
Yeah, look, I'll try and answer that. I saw the question on the list and I was like, how does one answer that? But I guess really right now it's all about cash flow, isn't it? And having cash reserves and try and cut back as much as possible and cut the spending, depending on of course, the industry you're in. But like I see my brother's business, my brother-in-law's business. They've all been devastated, and they're all in businesses you'd wonder how they were going to be affected by a recession such as this that's going to happen. And they have very much so. Like there's nobody that hasn't been impacted in a way here. And startups in particular, they probably have more of an opportunity because they can be more agile and they can cut their costs quite easily. And I think that's the key one. When you're at a certain point and you have a huge amount of I suppose burn going on in your business, it can be hard at times to cut back that burn very quickly. Whereas I think startups with their agility, they should be able to do that and weather the storm, hopefully.
Now's an excellent time to make those tough decisions. Sonia, any thoughts?
Yeah, I guess it's that whole thing of kind of really looking again at your USB and what your USB was before all of this occurred might be slightly different. And I suppose it's about thinking laterally about how you can transfer the core competencies that you have in another way, or kind of repurpose what you do in another way, if possible. So I was listening yesterday to a group called Fantastic, and they normally support patients, kind of vulnerable patients, and transfer them kind of from their homes to day centres. And so obviously all of that stopped. And so what Fantastic started doing was bringing meals to the vulnerable patients instead. So they repurposed their capabilities to deliver a different service, but still kept their service up and running, if that makes sense. So it is a kind of about finding a new way to use the skills you have to potentially deliver something quite different to what you usually do, but to keep your business up and running in that fashion, and still, do something meaningful with the team you have and the capacity you have,
Yeah, great answer. So there's the tactical issues such as cash flow, but then there's also a strategic opportunity to look again at what your value proposition is and how your business operates.
Yeah.
On that note, Sonia Neary from Wellola and Keith Lyne from My Clinic 365, thank you very, very much for joining the panel today, and best of luck with your business.
Yeah, thanks, Martin. Appreciate it.
Thanks very much. Thank you.
Take care.
Bye-bye.